The IEP process can be confusing to navigate. It can be hard enough to wrap your head around your child potentially having some type of learning disability, and adding a complex process to get them help just adds to the stress. That is why it is critical for school districts to take the time to explain the IEP process in detail what the future will hold for a child should they be found eligible. In order for a child to begin the process, the parent or guardian needs to be on board. Nothing can move forward without their written consent. The parent or guardian needs to act as an advocate for the child, as they often know the child best. And often, a child is too young to advocate for themselves. If the child is old enough to understand, it is important to involve them in any and all meetings as well. The special education and IEP process begins with a referral. A referral is essentially a request for an evaluation to be conducted on a student, and that request usually comes from a parent, school staff member, or other individual who recognizes a concern with the child. This referral must be in writing, that way it can be documented. Once the referral is reviewed, school and district staff have a certain amount of time to act. If it is determined an evaluation will take place, that will be done by a trained evaluator. This evaluation determines if a disability is present and gives the team a better idea of what the student can do and what they need a little bit more assistance in doing. If a student is found eligible, it means that a disability is found to be present. This disability must be one that interferes with the child's ability to learn properly. If this is the case, an IEP will be created by trained individuals on the special education team. A meeting will be conducted once the evaluation is complete to go over the results with every team member. And remember, the team does include parents and guardians. There are 8 main components to an IEP. 1. Current skill level. 2. Annual goals. 3. Progress tracking. 4. Special education services. 5. Duration of those services. 6. Participation in the mainstream class or general education class. 7. Testing adaptations. 8. Transitional goals and services. In order for an IEP to be successful, everyone on the team needs to be supporting the student. Everyone on the team needs to be on board with implementing the necessary services, and everyone on the team needs to understand the importance of the services. If a teacher, parent, or other school staff member does not feel that the implemented services are working, that needs to be discussed so changes can be made. Changes may also need to be made if a student's diagnosis changes or other issues arise. The teacher is often the person with the most responsibility when it comes to implementing services within an IEP. It is up to them to make sure they are following through with the expectations and guidelines laid out in the document, as not doing so would be a great disservice to the profession, but more importantly, to the student. The IEP does not have to be complex and overwhelming. Make sure to ask questions and speak up.